Good afternoon, everyone. Thanks for joining us once again for our Department of Labor and Economic Opportunity webinar series focusing in on workplace mental health. Certainly, it's Mental Health Awareness Month, so we've been doing a webinar a week and a lot of extra ones. We'll be back on sort of our normal flow in June, where it's just that one a month. Obviously, as we talk about, we move it around based on content and the speakers available. So we're really excited about today's. There's a Q&A box on the top of your screen. You can submit questions to at any time. We'll get to as many as we can at the end of the presentations. Make sure you get them in early. So often we'll get right to the end and people dump questions in right as we're wrapping up. So make sure you get them in early and as we're going along. Happy to try to get to as many as we can. And as always, if you haven't already, make sure you sign up for emails at our michigan.gov/workplace mental health page. All of our recordings, including this one and any corresponding materials, are posted there. They're also shared out to that email list afterward. And we have other links and resources there for everybody to check out. As you all know, our goal is to provide working people and employers with information about issues impacting our workplaces, the impacts to our mental health, and options for addressing those issues. And we keep talking about these sort of three pillars. So in our Department of Labor work, we're really focused on these three pillars, one of those being in the workplace, like what is the work itself doing to people? And we're going to talk about that today and things that we can do to try to help people. We're definitely talking about things that affect the workplace. So that's trauma and trauma-informed practices that come into the workplace. And then really importantly as well, that individual behavioral health support piece, because as we always say, I can't make you happy. There's definitely an individual steps that have to be taken, but certainly we want to tie them all together. So we like to talk a lot about systems. I think we learn about resilience and other things, and those are critical for our development, but we have to recognize we have to deal with the stressor as well. We can't just try to get people to be just more resilient without dealing with what's causing the chronic stress. So we really have to look at it as a system issue and make sure that we're continuing to think about structures, how we operate, how we work, how the people we work with work or work that work for us work. So today we're really going to focus in on a very, very important topic, kind of how do we help the helpers? I think we all know or hopefully have run into, so well, maybe you don't hope, but have worked with social workers in different areas of our lives. They're a critical piece of our society and make sure we're connected to everything that we need to have better outcomes. But it's challenging to be a social worker, and we're going to hear more about that today. So we have great partners joining us today. We have Fatima Salman, the Engaged Detroit Program Manager, and Dwayne Brijek, who is the Executive Director for the Michigan chapter of the National Association of Social Workers. That is a long title. And they're going to talk to us about how we help the helpers, the people that we need to make our society function well. So I'm going to turn it over to Fatima and take it away.
Thanks so much, Sean. Thanks so much for LEO for setting this up. Important topic, something that we hold near and dear to our own hearts. Dwayne, I think you want to change the slide. Yep. So I'm Fatima Salman. I do work at the University of Michigan Engage. I'm also the board chair for the National Association of Social Workers. And joining me is our fantastic executive director. And we're here really to talk about how to help the helpers. And there's a famous quote that always circulates that when there's things going on in the world, look for the helpers because they're always there. And we think that social workers are not just helpers, but also frontline workers, quite frankly. And I think this became very evident in the pandemic when social workers were at the forefront of the crisis work that was going on. So we've got 30 minutes. We'll try to pack everything in as quickly as possible and try to figure out how to help the helpers. So Dwayne, I'll pass it over to you.
Thanks, Fatima. It's really good to be with everybody here today. My name is Dwayne Brijek. I use he, him pronouns, and I'm the executive director for the National Association of Social Workers Michigan chapter. To get started, I wanted to give you all a little introduction. Some of you may have a good sense of some of the helping professions here in Michigan and across the United States, but for others, this might be some new information. In Michigan, social workers, we are the largest profession serving behavioral health needs across the state of Michigan. We're the only behavioral health field that has at least one licensed person in every county. We're very proud of that, although one is not enough, as we all know, in most of our parts of the state. Generally, social workers, though, we go into our profession because we want to find ways to support our friends, our families, our communities, create better systems that often have led to reasons why many of us become social workers, whether we've seen addiction or social injustice or workforce issues. There's lots of reasons that bring people into the behavioral health profession. Here in Michigan, we have about 31,000 licensed social workers. That is almost 3 times as many as there are licensed counselors. Marriage and family therapists have about 880 folks, and then our psychologists in Michigan are about 7,500. So total across all of the behavioral health professions, we're at about 50,000 licensed professionals, which is a good number. And we work in all sorts of arenas. So you might have experienced a social worker or a counselor in a school setting. You might work with us in the court system or the criminal justice system, in some of the policy and legislative work. And many folks know social workers, or maybe don't actually know that their social workers are their therapists or their clinicians around the country. I think the public perception has historically been that social workers work in child welfare work, but that's really only about 5% of our current workforce. The majority of our folks work in mental health, specifically doing psychotherapy. And so for all of you folks who might be seeing a therapist, I would imagine they're probably a social worker or a licensed counselor. But there are social workers that work in a whole host of other settings, including in admin and HR roles, and community organizing, and nonprofit work, and gerontology, folks who are working with those with developmental disabilities and housing insecurity, kind of every issue you think that we care about in the world, there's probably a social worker somewhere close by. I wanted to bring in some data. I know we've just got limited time today, but I think it's helpful to know that you've probably heard we're in a behavioral health crisis, which is true. There's not enough professionals for the needs that we're seeing, especially kind of in a post-pandemic climate here in Michigan. Some of the most recent data from CMS and the NPI registry provide this really good snapshot of kind of county by county, where are we seeing kind of ratios of providers to population areas. And maybe not surprisingly, our rural areas are some of the most hard hit for identifying where there are providers available. Partially that there's not a lot of schools or academic institutions that have schools of social work or even any sort of social work programs. But really almost our whole state is in an underserved area. Out of Michigan's 83 counties, only 15 have ratios, recommended ratios below what we expect. So 68 counties have scarcities of some degree in Michigan. What we also see in our state specifically is about 70% of Michigan's population is in an area of the state that has under need mets based off of the number of social workers, counselors, psychologists in the particular part of the state. And many of us, including NASW, the Counseling Association, the Psych Association, are working on creative ways to fill those gaps that we're seeing across our state. And I know the folks at LEO are also doing some really important workforce initiative work.
So what are we seeing? This presentation is primarily geared towards workplaces and those that are working with social workers in their workplaces. And so it's, obviously this is going to help people on the call or in our meeting today that are also social workers. But we really want to talk about in terms of if you're an employer and you do have a social worker that you have employed, or even a social worker that you're working with, and kind of recognizing what it is that they themselves are going through for you to be able to help them. So, just really quickly though, I do want to point out that Dwayne mentioned COVID. And if you look at some of those stats at the very beginning, on the very right side, it says 60% of employees are more stressed since the onset of COVID. I want to just pause there for a moment, because we could constantly talk about being in a post-COVID environment, but I think at the same time, we haven't even dealt with the ramifications of COVID on our mental health at all, in fact. And we've jumped back in so quickly that all these other things are kind of catching up to the already COVID issues that are happening. So just kind of pausing there and thinking about that for a moment. And then also thinking about these additional stressors that that people have. 67% of women have reported increased levels of stress compared to 45% of men, most likely because they're primary caretakers in their families. And then 49% of women find it difficult to balance work and home life compared to 35% of men. And so also remembering that there is a difference in terms of gender, there's going to be differences with single moms, there's going to be differences with different age groups. So we can talk about this as a blanket statement, but at the same time, keeping in mind that different demographics are going to show up differently in these stats. So what do we see? Social workers have a lot of compassion. We're supposed to, when we're sitting with the client, take us out of it, but that's hard. We didn't come into this work to take us out of it, right? And so compassion fatigue is something that we see most often with social workers. It's a type of burnout that occurs when a caregiver's empathy for their care partner leads to a heightened stress response. It's also sometimes known as vicarious trauma or secondary trauma. Burnout is something that we're seeing often, and that snapshot that Dwayne showed us at the very beginning also lends to those numbers going down in terms of social workers being, because of a lot of burnout that's happening. Burnout also is happening is because of the heightened load that social workers have in workforce in their agencies, the number of cases that are being piled onto them because there's less social workers. That means that the social workers that are there are taking all the additional cases. So keep that in mind, right? Is when you have less social workers or people leaving or not enough social workers in your clinics or whatever, then that also means that those people are taking the brunt of the burden. Which very easily can lead to burnout. Stress management, and then shift in workforce cultures, right? So we've got this whole idea of the culture of the workforce itself. And that has to do with whether it's hybrid, what virtual work, micromanagement in workforces, DE&I concerns that are going on in workforces, and lack of support and supervision. As we were thinking about this topic, a lot of this, and this is the work that I do at U of M, is really changing the culture of our workforce. That's what this is all kind of leading to. And it's not really a matter of just if you only have social workers or mental health practitioners in your workforce system, but really it's like, how do you create an entire system of wellness for all your employees that are there in the workforce, right? How do we become better businesses? How do we become better employers so that everybody comes out wholesome and feeling heard and feeling appreciated and still able to do the work that they need to do? Contributing factors, work, obviously, home and other life issues. We all have stuff that we go back home to, right? Medical concerns that are big issues, political climate, right? We don't live in vacuums. We live with all this stuff going around us, the national, international events that are happening, and then the lack of community and social supports. Interestingly, loneliness and lack of community is a really big factor in a really big contributing factor. So even thinking about in terms of workplace cultures, how to create those communities, how to create those social supports. And these are just some things that we're throwing out, but then also on your end, thinking of what are ways that within your workforces that you could kind of mitigate some of these or create some solutions around these. The next slide. Okay, so what do employees want? There's a lot of things employees want, but most importantly is paid time off. We're constantly like those little mice that are in those wheels running constantly around. And one interesting thing that happens a lot of times, and employers need to recognize this, is that many times the caregivers and the helpers, even though they may be offered that time off, they won't take it, right? And a lot of times it's because they feel they have to be there for their client. They have to be there. They can't leave. Things won't keep on going. And so sometimes you have to recognize that too, that the helpers are sometimes the ones that will accept help the least, right? So keeping those things in mind as we're working with our mental health practitioners and social workers in our employment agencies. Flexible scheduling, everybody wants that. Employee assistance program. And honestly, like, what social workers want and mental health practitioners want isn't going to be any much different than what employers want for themselves too. So keeping that in mind, what is it that you would want that would help the people in your workplaces as well? Permanent work from home options, on-site mental health care, virtual mental health coaching. And so they're all divided in terms of like ranked first and then ranked second, ranked third, and then in decreasing order. Holistic wellness program, group counseling or coaching, and chaplain services. So these are things that employees want. Do you offer it in your workplaces? How can you, and if you can't, then what are different resources that, and that's what we're here for also, is to help you also understand what resources are out there if you're not providing these things in your workplaces. Go ahead, Dwayne.
I just want to go back quickly to when we were talking about some of the impacts of the last couple of years on us all, and thinking about this lack of community support, social support, and isolation. I mean, part of the reality of what we lived in specifically in 2020 was literal isolation, right? We couldn't be around our friends, our families, couldn't go out in public. And I think it was really hard for systems to understand what the long-term impacts of that are going to be or were going to be, and how that kind of manifested in many of our employment settings. You know, a lot of us ended up being hybrid, some people fully remote. Some of the helpers were not remote and were in person, kind of taking a larger health risk the entire pandemic. Many folks being in settings where they were seeing people pass away on a regular basis. And so how does that kind of trauma impact folks at a work site as well? I know I was talking to one of our social workers the other day who was a lead clinician in a hospital during the pandemic, and their hospital had the highest death rates in the state because they were surrounded in a community of where there's large concentrations of nursing homes, right? And so the impact on that particular system where they saw huge turnovers in their staff. And so how do you rebound from some of that and get people really back in the mentality of socialization? It's been, I will say, as an organization that supports social workers directly, getting folks back doing in-person stuff. People want it, but it's a culture shift back into that mentality. And even our organizations, I think we've gotten used to doing a lot of presentations online, which make accessibility much better for folks, right? But there's something missed when we're not seeing each other, when we're not integrating with colleagues on a regular basis. And so I know part of this larger wellness conversation that we've been having as employers, as systems, as professions is how do we stay connected and build rapport as team members? Because when you think about, am I going to get burnt out? Do I feel supported at my work? A lot of that is, do I feel comfortable with my colleagues? Do I feel comfortable talking to somebody when I have an issue? And if the answer is no, then yeah, you're going to feel burnt out. You're not going to know what resources are available. You're not going to have options if you don't know the right people to go to. So I want to talk a little bit about a couple of different ways that what we can do collectively and then individually to support folks who are experiencing any of those mental health or wellness issues. And I want to just, I saw Anna's comment in the chat too. Yeah, nurses have been a huge part of this behavioral health and medical health during the last 4 years and historically as well. And we know the nurses also, very similar to social work, are seeing high rates of turnover, that we're seeing folks look at more non-traditional employment opportunities because some of those more in-person, high caseload, maybe high health risk jobs have, they seem less appealing maybe than they did pre-pandemic. So when we think about kind of organizationally for the HR folks on the call, for the supervisors on the call, supervision is a really critically important aspect of how we're integrating and talking with our staff. And really in social work, we like to think of supervision as mentoring versus more formal check-in for what are you doing on your day-to-day work. You want to be talking about, how are you doing, and really take the time to listen to somebody. And if that's not a normal conversation that you're having with your supervisees or your employees, that should be something that you start to build into your repertoire, is really those just regular check-ins. And there's a lot of creative ways to do it. If it's not part of your plan, there are lots of like pictorials, like pick which smiley face or frowny face or cry face looks right for you. There's sometimes we don't want to, we don't feel comfortable sharing in a group. And so finding some creative ways to do that, really looking at the wages and benefits, is part of the burnout based on those larger systems. If I'm not paid enough and we know inflation's high, cost of living is high, can I live outside of my work hours? Do you know what your wellness benefits are? Do you get good mental health care as part of your agency's benefit package? Some organizations have really good mental health support, some really don't. And so just knowing what that looks like, especially if you've never utilized that service before, do you have gym reimbursement or other sorts of yoga, mindfulness? There's lots of ways that organizations are getting more creative in terms of what they can fit into a benefit package. One of the movements within social work is paying interns. So how do we even start this conversation on day one for an undergraduate and a graduate student, releasing some of that burden, and that whether it's a financial burden or a mental health burden while folks are going through and becoming helping professionals. It's expensive to be a social worker or a counselor or a nurse, right? And there's some really good things happening in Michigan around these efforts as well. Fatima mentioned encouraging time off. Please take your time off. Fatima and I were both also acknowledging we're not great at doing this ourselves. And so sometimes it's really looking far ahead and just blocking off a long weekend here or there ain't going to do it. At least for me, it's not going to do it. That's not the reset I need. I'll probably need good 3 or 4 days or a whole week to kind of get myself back in the swing of things. If you're a manager, how do you model good self-care in your organization? Are you taking your time? Are you finding ways to creatively engage your staff? Are you talking to them in meaningful ways that you want to get to know them and know realistically how they're doing in their job? What does evaluation look like in your organization? Sometimes evaluations can actually be a really painful tool for people if they're not done right. Creating those spaces for wellness, many organizations are finding and developing physical spaces in their workspaces where people can go if you need to just take a half an hour and break. Maybe it's a quiet room. Maybe you've got a space where there's games present, where folks can go take a walk around the building or in their community. Social work is also all about advocacy and legislative change. So if there is something that you see systemically within your organization or outside of your organization, how do we advocate collectively on making change for that? And then depending on your workforce, you might have unionization or collective bargaining. Where may that play a role, if at all, in your particular organization? And then individually, we all need to identify our own stressors. There's plenty of things in the world that are getting us all stressed right now. So what are the things that personally are in your life? I almost, one exercise I like to do is think about yourself as like a pie, and what are the pieces that are missing in your pie, or maybe have bites taken out of them that you need to replenish at this particular moment. And that could change throughout the year. So it's important to continually reflect and see, okay, where do I need a mentor in X area? Where do I need support in this space in my life? My work is almost completely remote now, and I will say checking in with colleagues is a very different environment in a virtual space than it was in 2019, where I can't just walk down the hallway and chat to somebody for 5 minutes when I need a break from staring at the computer, because now it's almost all staring at the computer when I'm talking with my colleagues. So finding how can you check in a way with your folks that doesn't feel burdensome to you, that still makes you build that rapport with the people that are in your circle. Peer consultation, kind of like supervision, is something that we are really seeing a need for in the behavioral health fields. How are we talking to one another about the issues we're seeing, not only with the folks we're serving, but in the larger systems that we may be having issues against? So again, that bubble of professionals that you're consulting with on a regular basis. I love the incorporating leisure into your schedule. It's hard when you're in a 9-to-5 job to think about leisure as part of your work, but that is the shift we're moving to as a society. We have to be thinking about, what do breaks look like if you're at home working every day? Sometimes it's easier to get up and throw in the laundry or take a little walk, and other days you're like, I'm just staring at my screen for the entire an entire day, and making sure that you're building in space for breaks, because our brains need it, our eyes need it, and ultimately it will be helpful for our mental health. So I wanted to go through a couple of resources because I know we don't have a lot of time here today, so I want to leave some quick times for questions. There are some things that are out there for organizations and for individuals that could be as of assistance. So the state of Michigan has a lot of actually really good mental health resources on their website. So, I mean, I think pretty much everyone here probably either works for the state or is involved with the state in some way, but there are apps that help with calming down your brain, that can help with recentering yourself and getting yourself in a more mindfulness practice. There's a lot of training institutions that are starting to be developed to help organizations specifically almost do like a SWOT analysis of the organization, the organizational culture, and figuring out a plan that's best for that organization. You'll see that Healing Center restorative engagement there. So if you're looking for kind of that large scale change, I would highly recommend that organizations do an annual or a somewhat annual review of their wellness programs and surveying their staff about what's working and what's not working. You know, when things to get to a more extreme level, if folks are experiencing crisis or suicidality, in Michigan, we have got 988 in Michigan. We've got crisis text lines. You know, we've got lines for particular populations for our LGBT community and our trans community. These are really good spaces to know in an emergency. And hopefully we're not at that point when we get to folks who are finding themselves in a struggle. And then there's also some self-care tools. This will be available to everybody. So just a few resources. Anything I missed there, Fatima?
I think that's good. I mean, we're going to be sending this, our Sean and the team are going to be sending this out, so you'll have some of this available. But I think, like we said earlier, is that if your workplace doesn't have these tools and resources, there are other places you can go to, right? We can't be like the end all for everything. And we recognize that too from an employer's perspective. So where can you go out to? We did also add some additional readings and resources and citations if people have all that time to read. I hope you do. But these were some really great articles that we came up with. We want to open up, I know there's not much time, but we do want to open it up for question and answers if there are any. I know that Erica and Brandy have been manning the chat, or manning the chat. So if there's any questions, we'd love to be able to answer them. Dwayne and I are always available. Also, NASW, we can also drop in our emails after in the resources that are given out. So NASW is always a resource for social workers.
Yeah, the first one, an easy one, I'll just answer. As Fatima just said, if you're on our email list, we'll email this out. We'll also post it to our website, and the slides with that list of resources will be available. So we'll make sure that happens. Maybe for both of you, I was thinking about social workers. So we have some stuff we do as a state of Michigan when you're dealing with somebody, if they're seeing us, it's because something went wrong, right? That there's a real challenge, a real struggle. And in our work, we've done a lot of discussion around brain science and stress responses and everything else. And I think when you kind of pair that with, theoretically, if I'm seeing a social worker, that means I'm probably having a problem with something, right? It could be a whole host of things. How do you help the people you're trying to give care to understand why, like what's going on with their mind, why they're emotional, why, how that logic center is disengaged? I think we're trying to figure that out. Have you all thought about how do you engage a new client and say, like, hey, by the way, you're going through a lot of stress and this is what's happening to you? How do you do that?
I think it's really important. One of the tenets of social work is to meet people where they're at. And so first it's identifying what's the issue, right? And part of that is likely going to be talking about some brain science, but also knowing what sort of language you're going to need to talk to that individual person. That may be way too advanced for some folks. And there's a lot of tools and resources that are very graphic based that you can use. There's lots of really good videos online now that explain some of that brain science too. So when we know people are dealing with PTSD or generational trauma, there's really, it runs the gamut, right? And I think one of the things I think about when I think about social workers and a lot of the behavioral health workforce is oftentimes you're dealing with people at the worst moment in their life, right? And so how do you start at that place and get them to at least a safe place and where they can have some autonomy, there we can start to heal, right? And that's where having that network is also really important, that multidisciplinary, interdisciplinary folks. So how does the social worker know who the nurses are who are going to get them what they need at the health level? How are we partnering with the doctors, the educators? Because when a client comes in, they may be there for a very specific reason. Maybe they're there for an addiction issue. You may also then have somebody who's there because they're seeing a barrier to employment or trying to get disability, right? There's a whole range of the sorts of services. But when I think of the brain science specifically, I really like the examples and the tools that are available for little kids. If anybody has watched the movie Inside Out, the Pixar movie, I mean, I think about how we just think about emotions, right? And sometimes adults never got that education. And often I'd say probably the majority of adults never got that basic education. So how do we even pare it down into those very simple terms that people can identify and relate to? And yeah, I can send over some follow-up resources that would be specifically related to that.
Yeah, I love it. I think we're trying to identify, just so people understand, because they're dealing with difficult situations, they're not going to be as logical as they would be if they weren't doing that, right? Because you're responding emotionally different. I like, you mentioned vicarious trauma. As we've been doing this work, it feels to me, you know, at our end, that was kind of messaging behind the scenes here, obviously experiences trauma through their work, right? You as social workers experience trauma through your work. I think kind of what we've seen though is in those places, employers might not be really recognizing that and dealing with it. Are you seeing in the social worker space, employers really get on board with like, Fatima's enduring trauma because of her work, therefore we need to do whatever. How's that going out there?
You know, I think we talked about this earlier, but really it takes cultural change in workforces to be able to get to that point, right? It takes the employer being like, I need my employees to be at a place that they are going to be productive, functional, and all of that. What is it that's going to get them there, right? And recognizing that there's a lot that's that it takes for that, right? And recognizing that they're coming from places where, you know, that they're dealing with secondary trauma. Forget just the idea of trauma because of your work, Sean, but even just what's going on in the world around us. You're just everyday life stuff that's happening, right, is creating trauma around us. Generational trauma that happens through poverty, whatever it is, right? So keeping all these things in mind as employers is important to be able to, and look, the end goal is the bottom line is we want our workplaces to function. We want productivity. We want benefit. You know, we want this. We want to keep on going with our work. So if we're looking at it from that perspective, then I hope that we can work with our employees to get them the care that they need. I did want to add one thing, because we are in Michigan, is recognizing that, let's say you are pushing your employees to mental health services, keeping in mind that there are different stigmas that may be associated, keeping in mind that there's different languages and cultures that might be within your demographics of employees. So keeping those things in mind and recognizing that in Michigan, we do have different different agencies, Southwest Solutions, Access, for different types of cultures and language issues too. So it's not that it's not findable, it is findable, but paying attention to those types of nuances that we have in Michigan as well.
Okay, so we're a couple minutes over. We'll do one last question, then we'll wrap up. This is a good one. I'm going to chime in just real quick with a plug first, but how do you help large organizations shift the culture so that fatigued workers do not feel punished for taking care of themselves? First and foremost, come and check out our stuff at michigan.gov/workplace mental health. Check out the report. There's a building the business case in there, recognizing for employers from an employer perspective, like mathematically, this is good for the bottom line to have people take their time, be healthy, be whole, and kind of move forward. But Fatima and Dwayne, do you have anything to add on how we help shift cultures?
I think it can't be isolated. I think if you don't have the right people to shift the culture will never be shifted. And so there are organizations like the Healing Center Restorative Engagement Group that do exactly this. They partner with small, large, statewide organizations to look at what is the current setup, what's working, what's not working, what's the goal. And I think organizations also, it's starting even at the hiring process. We want functional workspaces. So are things, how are your interview process? What sort of candidates are you bringing into employers? Are you looking at geographic and demographic representation in our state? But I think organizations can do, and maybe the last piece of advice, because we're in a strategic planning year as an organization at NASW. We do 3-year kind of large scale goals. How is wellness integrated into your policies and your organization's strategic goals? And if it's not visible, then how is it actually, what's the follow-up look like if it's not that laid out and transparent to folks?
I will put a shout out to HCRE. It's on the resources. They're the Healing Center Restorative Engagement Group, and that they are working with employers and doing almost like consults with different groups and agencies to see whether or not you're creating places of wellness and wholeness. And there are some best practices and examples out there. And maybe that could be your next topic. Where are places doing it right?
Yeah, that's what we've been looking for. So I appreciate that, Fatima. And just thanks again so much to Fatima and Dwayne for joining us today. We had a couple other things in the Q&A. Employer reminding employees every 6 months about EAPs and suicide hotlines. Good job, keep it up. Crime Survivors and Alliance for Safety and Justice has Crime Survivors for Safety. Feel free to check that kind of stuff out. But just thank you so much. I think it's really important. If we haven't mentioned it a few times, the work that you do as social workers, we really appreciate you because you are such a huge piece of our society, often overlooked, often forgotten, but needed all of the time. So just thank you both so much and appreciate you sharing this information with us today.